Are you looking for the best online education at the most affordable school fees? Enroll now at Jose Maria College. Jose Maria College, under the leadership of its founding president, Pastor Apollo C. Kibuloy, holds true to its mission of providing an assured, consistent, and quality education amidst the ongoing crisis on COVID-19. To ensure that all students will get the best learning experience, JMC provides an assured education with the most flexible learning delivery choices. To highlight the learner's wit and abilities, JMC is consistent in providing the best learning exposures with a student-centered showcase of extracurricular activities. Amidst the challenges of the new normal, JMC guarantees that quality education is not compromised through our learner-centered curriculum, highly trained and dynamic faculties, and state-of-the-art facilities designed to deliver the best learning experience to our students. We are proud to say that JMC is fully equipped for new normal education. What are you waiting for? Enroll now! Scan the QR code on your screen for more details. Your future is our mission. Enroll now!
Do you want to have a lab life? Are you a person who is curious, process-oriented, accurate, self-sufficient, and fascinated by science? Do you have keen observational skills, good color perception, and manual dexterity? Are you able to work under pressure, work alone and with a team, and are accountable and responsible? Then you might just be one of the many who is qualified for a lab life. Enroll in BS Medical Laboratory Science Technology or BS in Medical Technology at Jose Maria College. There is a vast landscape of opportunities waiting in the field of medical laboratory science work. You can choose where you want to spend your lab life with. Medical technology professionals are mostly sought after in hospitals, private laboratories, university research labs, public health facilities, biotechnology companies, specialty labs, scientific equipment sales. In Jose Maria College, we have highly trained professionals and high-tech facilities to help prepare your future lab life. Enroll in Jose Maria College and flex on the new normal in education with our flexible learning modality for an assured, consistent, and quality education. For more information, visit our website at www.jmc.edu.ph or our Facebook page at Facebook/Jose Maria College. You can also email admissions@jmc.edu.ph for admission requirements for the BS in Medical Laboratory Science Technology.
Good evening, J Marians. Welcome to the second episode of JMC's MedTechHour. So today we will be discussing more about the College of Health Science under the program Medical Technology Medical Laboratory Science. And therefore you will be with me for the whole 1 hour this evening. So I hope that you will be able to learn something about what medical technology is and what medical laboratory science is. So for those of you who are tuned in and are interested in learning more about our profession, tune in and let's talk. Okay, so let's start by saying that ayan. So for the last time, you were with our dean, or the college dean, who is Ma'am Bea Lau, who talked about who are we, who are the medical technologists, and what we do. So for the last Wednesday, you have learned about the different career opportunities and the profession itself. But for this evening, we will be talking about interesting and morbid, the morbid side of being a medical technologist. So for those who are tuned in, this is JMC's MedTech Hour, especially time for medical technologists to introduce to you our profession. Okie dokie. So for this evening, we will be discussing about the difference of what infection versus infestation. So maybe in some instances, we have mismatched the usage of these words. We have mismatched infection and infestation. So to learn more about how to use the correct word and to deepen your knowledge about infection and infestation, I am Mary Chelsie del Mar, and I will be your host this evening. So I am a college instructor of the College of Health Sciences under Jose Maria College of the program Medical Technology. So we have a little disclaimer here because this presentation includes showing of morbid pictures related to infection and infestation. So what are morbid? It's like maybe your stomach cannot take it and you're about to puke when you see it. So it's the real and live icky and yucky pictures of the descriptions of infection and infestation. So let's start. So I believe that everyone has experienced or encountered this through their relatives, maybe their nieces or their nephews have experienced this kind of disease. So in the picture, you are able to see a lot of head lice or head louse. Okay, so actually, class, those are insects and they are parasites, but they depend on the nutrients of the host that they are getting their nutrients from. And the next picture shows a disease on the surface of the skin, and that white things there, that pustule or the yellowish portion over there is actually a sign of an infection. So in these two pictures, actually, we can denote what infection and infestation is. Okay, so let's go back to the first picture. This one, it's living inside the host. Okay, it's depending its life in a host, but you can see them from the outside. And however, this one, this is just a reddish infection, and you know that it is below the surface of your skin, therefore it is inside your body. So that is infection. So let's define infection. Infection now is the invasion of microorganisms that causes a disease to the host. So microorganisms, it includes parasites, bacteria, viruses, or generally for the general population, it's just germs. Okay? But actually, class, we can define germs and microorganisms into classifications because their definition, or their classification depends on their characteristics. So again, your germs or your microorganisms can be bacteria, parasites, or viruses. Okay? So again, your infection is the invasion of microorganisms, meaning for them to survive, they have to go inside. They have to invade parts of your body. Okay, so here. So again, it is caused by microorganisms such as protozoans, okay, your fungi, your bacteria, and your viruses, your protozoans or your parasites, okay? And your microorganisms, they enter the tissues of the host, may it be human tissue or animal tissue, any living tissue that they may be able to survive and thrive and live. Therefore, they can multiply, they can arrest the normal physiology of the cells during the infection. So what does that mean? If the normal tissue of the human body is smooth, inside it is smooth and pinkish, now when there is an invasion of microorganism, particularly bacteria, then that normal smooth and pink tissue of the human body will become black and curly, or it will be different in its form and its texture because of the microorganism that is thriving in that tissue. Okay, so for this example, this picture that I've shown earlier, so this is a characteristic of a boil. Okay, a boil in our Visayan language, we call that matagtiki, or in Tagalog or in the northern part of the country, in Luzon area, they call that pigsa. So this pigsa does just not occur there just because, okay? It occurs in the skin or inside the skin because the bacteria usually that infects that skin is called Staphylococcus aureus. Now let's go back. So infection now is the invasion of microorganisms, including your bacteria. Therefore, that infection there, that disease process under the skin is caused by a bacteria which is called Staphylococcus aureus. It thrives in the skin. It gets its nutrients in the human skin. Now, while it's getting its nutrients from the human skin is damaged. Immune response is triggered by the body. That's why there is redness, there are pustules, there is pus, there is a development of that yellow liquid form in that very picture, because there is an invasion again of bacteria. Okay, I hope I am understood. Later in my discussion, I will be entertaining questions. If you have any questions, clarifications, we will answer those. Okay, for now, I can't see your questions, so we'll proceed with our discussion. Now, here is a typical picture of a person or a human person having a stomach ache because he is crunching his back. Okay, and on that magnifying arrow there is called a worm, right? So what happens is that person is infected with what we call Ascaris lumbricoides. Okay, Ascaris lumbricoides is a protozoan. It's a parasite. It's a worm. It's a bitok in the Visayan language. Okay, it thrives in our stomach and it multiplies there. It becomes an adult. So when you get it, you get it from infected food, infected water. What does it mean with infected food and water? The food and the water that you are drinking, it is contaminated with this parasite. Now, when you are drinking water and eating food that is contaminated with this parasite, it thrives now in your body. Okay? It causes a disease process in your body, and it transforms from a baby or an egg, and it goes into its morphological changes and transforms into a worm. So that is another example of infection because we find it inside our body. We have to do laboratory testing, especially stool analysis, for medical technologists to be able to identify and to diagnose that you are infected with the worm. Next, there. That is a classic example of the adult worms infecting the human intestine. Actually, that's a large intestine. And mind you, the infection that is caused by your ascaris is called your ascariasis, hence the name on the picture. And those spaghetti worms that you find on your screens are the adult versions or the adult forms of your ascaris. So, okay, infection, they invade the body. They go inside the body and they cause infection. They cause a disease process and they cause changes in your body. Now, let's go to infestation. Okay, infestation is the invasion of insects and worms that causes a disease to the host. Okay, you have to remember that infestation, invasion of insects. Okay, they also cause disease to the host. Also, it is caused by the invasion of complex organisms such as your insects and your worms. And insects or worms that reproduce on the surface of the host or inside the lumens of the host. Okay, so if the causative agent for your infection are your microorganisms, infestation, on the other hand, is caused by insects and worms that causes a disease process on the human body. So, sila yung rason kung bakit nagkakasakit pa rin tayo. Pero, insects or worms sila. Iba yung kanyang classification from the microorganism. Hence, our first picture, which is head lice or kuto on the hair of this woman or this man. Okay, so as you can see, our head lice, okay, they are actually arthropods and they are insects. They infest the human body even though they do not go inside the human body, but they thrive on the surface of the skin. They thrive on the hair. They suck blood from the host for them to be full or for their nutrients, where they get it. That's why they consider we consider them as a disease process, or they cause harm to the host. Okay, next picture, we have some bees on the doorstep or like inside like the porch or inside the home. So if these bees are large enough to invade your house, then you will not be able to go inside your house and live there. And mind you, the stings of the bees are also causing disease to the human body, especially if the human body has hypersensitivity to the bees. So that's why it is still called infestation of the bees. Next, these are worms. Okay, it may not be found on the surface of the human body. It's found on the surface of the tree, but that is also a classic example of infestation of pests. Okay, in the worm or on the tree rather. So therefore, if we differentiate infection and infestation, we come up with this table of comparison. Okay, so again, infection is invasion and growth of germs in the body. Okay, it is caused by your bacteria, virus, yeast, fungi or other microorganisms, so as your prions are included there, they begin anywhere in the body and they can spread because they have the ability to multiply, okay, and they cause fever, health problems depending on where it occurs. Okay, now infestation, it is the presence of an unusually large number of insects or animals in place, typically so as to cause damage or disease. They cause damage to human houses, causing damage to your farm lots. That is pest infestation. And in the end, it causes a disease to your crops, therefore affecting your living. Okay? Yeah, so there we go. So now let's take a quiz. So because I can't see each and every one of you, and I don't know, let's try this. Okay, hold on. Let's go to my phone because we are live. I want to see how many viewers I have for this evening before we proceed to our quiz. Okay, so for those who just came in, therefore affecting your connect have for this evening before we proceed to our quiz. Okay, so for those who just came in. Ayan. Greetings, yes. Good evening. Marami naman pala tayong viewer. Good evening po, good evening. So if you just came in, I'm discussing infection versus infestation. And I have explained the differences between what infection and infestation is. Okay, these are topics that we learn when we become medical technologists. And to properly use these words, we are able to differentiate how infection and infestation is different from one another. Okay, so are you ready? 19 viewers, 19 million viewers. Okay, so let's show picture number 1. Okay, so picture number 1. This is a part of our body, especially in the oral buccal region. Okay, so that little thing here, that's your tonsil. Okay, your uvula, and then those two enlarged kasi yan sa class with white spots. Ibig sabihin, there is an infection of your tonsils when you open your mouth and you flash a flashlight over there and then you look in the mirror. Okay, you see two oval shape side by side in your throat. Okay, so yan siya ang tonsils. The normal appearance of your tonsils are just red and it has a smooth surface without that white spots. Okay, but when you have an infection, it's called tonsillitis. Okay, still caused by S. aureus or Staphylococcus aureus. Okay, so when you are infected with that bacteria, that is actually now called as infection. And already in that picture, there is a disease process because my formation of your pus. Okay, yung white spots dyan is actually pus. Yan. Next, we have a woman experiencing an infection. Okay, good evening. Hello. So that woman is actually suffering from acne or cystic acne. So your cystic acne usually is caused by a bacteria as well. Okay? So kaya siya may bumps and there are white pusses again because it is infected with the bacteria. Okay? Alright. Next. Ayan. So that is actually also an infection of the eye. Okay? So you see that straw-colored worm that's coming out from the eye, that is actually called the parasite loa loa. So it infects your eye. So if your vision is 20/20 and whatever you see is crystal clear, you know that the sky is blue, the ocean is blue. But if you are infected with loa loa, there is like a disturbance in your sight. Okay, you cannot see clearly because that worm is like a snake in your vision. Okay, so parang palaging may shadow or may snake sa inyong vision due to that. And the extraction of that worm is through opening your eyes and then actually ginapira siya. Ayan, kaya natanggal yan siya. Natanggal si lowa-lowa sa eye ng patient. Next is what we call elephantiasis. Yan. So that is also caused by a parasite class. They thrive in the lymphatic system. Okay? So it's called an infection because it alters the normal body function. Next, also the yikes, I know. But I don't think that's very rampant now in our country, but some still is still infected with elephantiasis. Next, we have polio. Okay, so polio is a virus, poliovirus. Okay, so kaya the Department of Health, together with the collaboration of from the WHO, if you've heard poliovirus na oral poliovirus for children below 5 years old, especially here in the city, that is what they want to prevent, to have polio eradicated in the city and in the nation as well. Kasi nga, ganyan yung nangyayari for patients na nagsasuffer from the infection, which is called your polio, from the poliovirus. Next, this is a disease process for dogs. And that's called your karapata or your crab louse that you can find in your dogs. So that is infestation. They cause a disease to the animal, which is the dog, and the dog is their host. And they thrive on the surface of the skin, the hair of the dog, and they get nutrients by still sucking blood from the dog. So it's still a disease process and they cause damage to the dog, which is their host. Next, have lice as well. Lice that you can find on your eyelash. Class. Diba? Still an infestation. That is an example of an infestation not directly to the body, but on the door. Okay? Kasi nakahang siya sa ceiling ng door ng farmhouse na yan. So that is a huge number of a bee colony or a beehive. And it actually is a cause, is considered an infestation of bees. Okay. Next, this one. That is a mosquito. So, diba, mosquitoes, actually, they are carriers of dengue virus. And they are also carriers of the malaria virus. So, if you are not throwing your stagnant water, mosquitoes will thrive there. And your female Anopheles, which carries your malarial parasite, if present in your area. And then if that, your female Anopheles will go and stick you or suck out blood from you. Therefore, it will cause you an infection. So, si dengue and si malaria na galing kay mosquito because you're not cleaning your surrounding, na-infect ka, tuloy. So, both infestation of the mosquito that's harboring the parasite and the virus. Now, if they bite you, you're now infected with those two things as well. Okay? And that one. Rat infestation. Imagine if your household is infected with rat. How will you able to live properly in that household without considering your health? Okay, without assuring that you are healthy. If you are infested rather, with rats. Yan. Ew. Okay. So I think that ends my discussion about infection and infestation. So, meron kaya tayo mga questions. Okay. Ayan, may greetings pala tayo. Hi, Ma'am Bea. Our dean is watching. She's saying greetings to all our viewers. Hello po. Welcome. Welcome to Jose Maria College MedTech Hour. Ayan. So, Alaika Prado, hashtag JMC MedTech. So, hello, Miss Alaika. I am hoping that I'm going to see you next semester. As well as Mr. Jomar Sambilon. Good evening po, Sir Jomar Sambilon. Hello, welcome to JMC's MedTech Hour. Good evening din po, Ma'am Marie Therese Soterno. So I hope that you learned something about what infection and infestation is. Hello, Ma'am Crystal. Hi, Ma'am Crystal. Yes, you're welcome po. I hope you've learned something, ma'am. Ayan, good evening din po, Sir Roldan. Konnichiwa. Abikibel Colon. It's konnichiwa, so I will say konbanwa, if I'm saying it right. Good evening din po, Sir Rafan Dekain. Good evening. Good evening po, Rhea Ray. Ma'am Sir Rhea Ray, good evening din. Oh, sabi dito ni Sir Yuri Canseco, yikes. So I know that nag-react siya doon sa elephantiasis. So I know, sir, it looks yikes. Floravel Narvasa, good evening din po, ma'am. Good evening, good evening, good evening sa lahat. So I hope that you were able to listen. Good evening din po, Sir Janel Antero. And oh my God, good evening, the Dr. Red Hinay, all the way from Japan. Oh no, I hope I'm saying the right things, Sir Red. So Sir Red is my professor, but he's still young. Okay, let's not disclose the age. Okay, so I hope that everyone has learned a little something for this evening. So if you have friends, if you have relatives, if you know someone who is interested in learning what I have just discussed, you will enjoy more and more as you progress through the program. You will not only see these parasites, these microorganisms, we will be able to discuss how their life is, their lifestyle, where they get their food from, how they live, how they survive, and how they infect the human body. So if you are one of us who are very interested in learning these things, then I bet medical technology and medical laboratory science is the right program for you. And mind you, JMC is offering this program with special edition curriculum courses like forensic science, like EMT or emergency medical training. Yun. So if you are also into rescuing, attending to vehicular accident victims, yeah, so to properly address their issues and to properly assess their physical state, so kailangan nating mag-undergo ng EMT training class. So if you enroll in medical technology in JMC, you will be able to get all those trainings. So by the time you graduate, you are equipped with the necessities of becoming a healthcare professional. Okay, so good evening din po, Ma'am Sheng Aranchada. Wow, thank you, ma'am. So thank you. Sabi niya kasi, very informative po ng episode na ito. Thank you po. Wow, thank you din po, ma'am. And good evening also, Aini Rose Juanita. So now you are capable of saying that, oh, I am infected with this bacteria. That's why. And if you are having a lot of insects in your household, okay? You say, our house is infested with rats. Diba? In a social way, but you are using the words correctly. Because infection and infestation, they have different causative agents. But both of these terms, they still, what do you call that? They still cause damage to the host and to the household. Okay. So wala naman tayong questions. I think we will be back for a short break. So watch the advertisements after this talk.
Well, the new learning setup actually both challenging and convenient, especially for working student like me.
As an accountancy student, engaging this new normal setup is quite challenging for us students as well as the teachers such as.
But with the help of the JMC instructors, it lessens the burden and help us to learn in a convenient learning environment.
Senior college teachers and staff is very considerate when it comes to the problems that we are currently dealing with. They help us to understand and completely adjust with this new setup.
I decided to choose Senior College because it offers high quality education, which I believe would help me achieve my dreams and goals in life.
In terms of financial, there is no problems at all because JMC offers a scholarship which is the gift of education, which is it helps me a lot in order to afford my tuition.
The Jose Maria College actually provides a culture of excellence. It actually gives an opportunity to everyone to lead, to learn, and to become a better individual. I would justify that because I myself experienced how the Jose Maria College did very good for me.
I was inspired by the principles of Pastor Apollos Hikibaloy in molding students to acquire quality education and excellent performance in our institution.
Thank God for showing me the path to enter JMC school, and of course to our founding president, Pastor Apollos Hikibaloy, for helping us to pursue our dreams. That's why I was really inspired by the theme, Your Future, Our Vision.
Okay, so we have learned earlier about infection and infestation. Now we will be discussing, and I forgot to tell you that the College of Medical Technology in Jose Maria College, we offer now asynchronous and synchronous classes. Okay, so online pa po tayo because of the pandemic. So if you wish to enroll in Jose Maria College's College of Medical Technology, I am honored to present to you that we are doing asynchronous and synchronous and blended learning classes. Okay, so to start, we have these facilities that in the near future, when we have our herd immunity, that we are prepared, and this is our school. Okay, so this is our library on the one on the screen. So if ever you wish, puhon, when the pandemic is over, you wish to go to the library here, you will see that it's equipped online and we have books available to your needs. Okay, next. We also have, oh ayan, library pa po yan namin. So ang ganda-ganda. So very conducive for learning, reading. And of course, for our aspiring medical technologist, may I present to you, this is the laboratory that you will be working in. You will spend your whole college life in these four corners studying about the morphology, the characteristics of parasites, microorganisms, doing chemical analysis, okay, enjoying chemistry. So this is your laboratory. We have fully equipped microscopes, desks, and here, oh, ayan, on the right picture, we have our faucets and our labs ready for you. Ayan, that is our anatomical lab or human anatomy lab. We have 3D equipments of the human body that you are able to hold, touch, feel, and see and study when you undergo the human anatomy class. When you enrolled in the College of Medical Technology or in the program Medical Technology, we also have a setup for patient interaction. We have hospital beds with patient lying in there, but there are models lang ha, hindi sila live. So, mapapag-aralan nyo ng mabuti yung function niya, yung histology, tissue, and the morphology of the human body. Ayan, we have our audiovisual rooms, okay, our theater rooms. And the newest program in the community, in the college, is the Bachelor of Science in Medical Technology or Medical Laboratory Science. Okay, opened lang po yan last year. Hence, we are here. Okay, and then we are also telling everyone that JMC is prepared for the medical technology profession. So we are following and strictly, we have been released the CHED RO11 last February 14, 2020, that we are now allowed to operate our program. So what are the career opportunities for medical technologists? Okay, so you can be what? Analyst. Your number one job is to analyze why there is a disease process. Hence, kaya pinag-aaralan ng mga medical technologies natin kung bakit nagkakaroon ng sakit. Bakit nagkukos ng sakit ang bacteria? Bakit nagkukos ng sakit ang parasite? At bakit nagkukos ng sakit ang COVID-19? COVID-19 is actually a virus. So, sino po ang nag-aaral ng COVID-19? Aside from the virologists, wherein they have specialized, they have devoted their career and their study to study your viruses, medical technologists also studies viruses. Actually, we are the one who are doing your swabbing. We are the ones who are doing your RT-PCR testing, all your testing. Medical technologists po ang gumagawa niyan. Hindi po si nurse at hindi po si doc. Si nurse po yung nag-a-attend sa needs ninyo and other things. Okay? Si doc po ang nag-a-assess sa lahat your whole well-being. Si medtech po ang nagte-test ng lahat ng samples na pinapadala ninyo sa lab for us to know or for the doctor to know what disease process you are currently experiencing. You can also become water analysts in water laboratories. Yung mga tubigan, yung mga mineral water na binibilhan ninyo in your subdivision or in your community, they have to pass a water testing. Okay, to make sure that there is no microorganisms, contaminants that will harm their clients. Okay, we also have opportunities in blood banking facilities. So ano po itong blood banking? Have you ever heard of someone saying na we need blood, we need units of blood, kailangan masalinan ng dugo sa ganito, sa ganyan. So, yung binibigay po na dugo sa patient ninyo or sa mga kakilala ninyong napagsalinan ng dugo, okay, the medical technologists are the one preparing that blood to ensure safety of both the donor and the recipient of the blood. Okay? You can also become clinical instructors and professors like what I'm doing right now. So we are touching life, we are molding, okay? We are honing the lives of our dear aspiring medical technologists. We want them to be equipped that by the moment they graduate and by the moment that they practice in the laboratory, they are well versed of what they are doing. Next, they are implementers and movers. So public health implementers and movers. So most of the healthcare workers, they go hand in hand with our nurses. They do field work. Okay? They do disease analysis in certain communities. Okay? So if you want that job, you go to far-flung places. You can also do this when you become a medical technologist. Also, you can be a researcher, an epidemiologist. You can be an analyst and quality control officers in research laboratory. Okay, so these are your career opportunities. Okay, you are researchers. You are experimenting a lot of breakthroughs for science or in science. So vaccine is also a breakthrough. It is a product of experiments from our researchers. Okay. Same with the epidemiologists. So we will not be able to know how many cases COVID-19 is infecting the whole wide world if we don't have the epidemiologists. So these are our scientists who devote their time and their effort in identifying how many are infected with the virus that we are currently experiencing. We can also be laboratory equipment and product specialists and entrepreneurs. So I have a lot of batchmates that instead of venturing into hospital and field work, they went into being product specialists and entrepreneurs. So what do? They study the anatomy of the machines that medical technologists use. Okay, kasi po, hand in hand in being a medical technologist in the field, you have to work with equipment. Okay, they are your everyday tool. Okay, so these equipments, they need to be maintained, they need to be they need to undergo preventive maintenance, so for them to correctly perform their duties, which is to analyze our samples. So our product specialists, our entrepreneurs, they are the ones in the field who studies ano ba ang dapat or ang naaakmang gawin for this equipment to work properly, to process 300 samples in 1 hour. Okay? So sila ang gumagawa nun to help the medical technology community as well. And of course, we are also analysts and consultants in molecular diagnostic laboratories. So this is a part or a section of the laboratory wherein they focus on the DNA extraction, RNA extraction of your viruses. So actually, if you've yung RT-PCR ng COVID-19 or the swab test in layman's term, it's actually an RT-PCR testing where your medical technologist extracts the genes of the virus for us to determine if you really have the virus. So it means if you are positive with the RT-PCR testing, therefore you have the gene of that virus that's infecting you. It is a special section because it requires a lot of restrictions and tedious processes, and of course safety precautions to be able to protect the medical technologies from getting the infection, and of course to protect the sample. Ganyan siya, class. And lastly, medical technology is an excellent pre-medicine program preparation. Can I get a yes from Sir Billy? From Sir Billy Almakna, who is watching? He is actually a med student right now. So yes, it is an excellent pre-med. So if you wish to become physicians in the future, medical technology is the best preparatory course for you because you are now equipped with knowledge and understanding of the diseases the human body encounters. Okay? So are we ready? Ayan, I have a yes from Sir Billy. He's saying that the medical technology is the best preparatory course for medicine. Kasi hindi na siya nahihirapan, ibang subjects na. Hindi nahihirapan si Sir Billy kasi ang talino po ni Sir Billy. Okay, so the facilities are equipped. We have faculties who are also very, matalino, Charla. Credited faculties, okay? So we are also, our curriculum is also aligned with the CHED Memorandum Number 13 series of 2017, and we have established linkages in various industries, community extension service, and research endeavors. Okay, next. So, wait pa daw, there is more. In JMC, we are student friendly. Of course, we are very considerate, especially now that we are doing online classes. Mind you, hindi lang po ang mga estudyante ang nahihirapan, pati din po ang ating mga educators. Okay? We are trying the best that we can so that we can be able to deliver quality education and information to you. Okay, we encourage a culture of collaboration and innovation, unique course offering, because as you go through the program, we offer forensic science for medical laboratory science. So that's the first in the nation, very new. So if you are into forensic science, okay, what are the career opportunities for that? You can become a SOCO investigator or scene of the crime investigator. Okay, you can become investigators. You can become the analyst in that crime scene investigation. So that's very interesting. Okay, you also have emergency medical service, NC2. This is a training, and if you successfully finish this training, you are equipped to help in emergencies, and we have clinical simulation program po. Ayan, so pre-internship po yan siya, pre-internship preparation wherein we are going to equip you with skills and knowledge that before you enter your internship, okay, you already know what you are doing. Okay. So yeah, we also have our mentoring program and our remedial program. And yes, here it is. Just like I've mentioned earlier, we are offline for especially this pandemic. Offline or online, okay, you can choose, and blended online. So before, if you are enrolling, there will be choices for you to choose. If you wish to be online, go ahead. If you wish to be offline, go ahead too. Now, blended online learning is blended, meaning there's an online schedule for you where you and your teacher will meet and will discuss matters, and of course offline activities that you will be doing as well. Ayan. Hello po, Doc Abby Abdul Grande Abbas. Hi, how are you doing? Ayan. So, of course, for the admission, all you need to do is you have to remember to bring or to have your documents in PDF file, because I think they also do online process or online enrollment. Prepare your report card, your TOR, your good moral, your PSA, or your birth certificate. And you can visit the site for enrollment processes. Yan, there we go. jmc.edu.ph. Down payment is just at 1,000 pesos. And we can also accept payments through Dragon Pay, remittance centers, and Metro Bank. So, ayan po. So, if you have questions for me, I'm open for question and answer portion. Yung answerable by yes or no lang po. Okay, hold on. We are done with that. So, meron ba tayong mga questions dyan, mga ma'am, sir? Hello? Marami tayong comments, so I'm gonna read comments. Enroll now in JMC, of course. Yes, from Ma'am April O'Donnell. Hashtag enroll now in JMC. Yes na yes. Oh, Sir Billy, Sir Vincent Billy Domingo Amacna. Hello po, Doc. Good evening, Doc. How's med school? Ayan, may heart tayo from Sir John Carl Espanola. And heart again. Oh, thank you, Sir Abdul Hatagrande Abbas. Thank you. He's saying, enroll now at JMC. Ayan. Thank you po, Doc. Doc Abby. Okay. So, if our viewers doesn't have any question, I am sincerely thanking you for being with me for the last 52 minutes. Thank you. Oh, again, 56 minutes na. So, malapit ako mag 1 hour. So, thank you very much, everybody. I hope that you have learned a little something this evening about what is infection and infestation. So, we would like to thank JMC MedTechHour. So, for the viewers, JMC MedTechHour is a production of the College of Health and Science by Jose Maria College. We would like to thank the Communications Office, Ma'am Mirna Ambrosio, our Communications Director. Thank you for being always with us, Ma'am Mirna. And of course, we'd like to thank the Information and Communications Technology Office, headed by Mr. Paul Kenneth U. Santorias, our ICT officer, who's always willing to go and beyond if we have problems for presentations. Thank you, Sir Ken. Okay, and thank you to all our viewers who is with me this evening. And of course, I'd like to thank our Dean, the College Dean of Health and Sciences, Ma'am Bea Lau. Thank you po, Ma'am Bea. Okay, dokes. So this has been MedTech Hour. Thanks for watching today's episode. Until next time, goodbye and keep safe, everyone.
Are you looking for the best online education at the most affordable school fees? Enroll now at Jose Maria College. Jose Maria College, under the leadership of its founding president, Pastor Apollo C. Kibuloy, holds true to its mission of providing an assured, consistent, and quality education amidst the ongoing crisis on COVID-19. To ensure that all students will get the best learning experience, JMC provides an assured education with the most flexible learning delivery choices. To highlight the learner's wit and abilities, JMC is consistent in providing the best learning exposures with a student-centered showcase of extracurricular activities. Amidst the challenges of the new normal, JMC guarantees that quality education is not compromised through our learner-centered curriculum, highly trained and dynamic faculties, and state-of-the-art facilities designed to deliver the best learning experience to our students. We are proud to say that JMC is fully equipped for new normal education. What are you waiting for? Enroll now. Scan the QR code on your screen for more details. Your future is our mission. Enroll now.